What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, testing negative for all the viruses, and having a great day so far. It is time now for the Wednesday edition of the Virus Update for Wednesday, October 1st, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, information, and anything I can find to help keep you safe on these viruses, especially the COVID virus. The COVID virus does cause a lot of problems. If you want to stay informed, subscribe to my channel down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. For every person that subscribes to my channel, hey, you help me reach my goal of 10,000 subscribers by the end of the year, which the more people I can keep informed, the better, because things are really bad. Alrighty, we're going to be starting off with a new study that just came out. This is pretty big. We're going to do things a little different with this study. You'll see. It'll make sense to you. Those who have followed my channel for a long time will fully understand why I'm doing it differently. Also, we do have several other news stories to look at. We do have some daily data, and I think we will end today at least a couple of wastewater sites. Alrighty, we got to start with this study. This is some big news. This is some not good news. Risk of long COVID in children may be twice as high after a second infection. A new study in the Lancet Infectious Diseases involving 460,000 plus U.S. children found those reinfected with COVID-19 during Omicron had twice the risk of developing long COVID. Again, that is twice the risk of developing long COVID. This is really bad. This is really serious. This should be an eye-opener. So here's the study here from the Lancet, and we do have highlighted a portion of this study where there's symptoms and conditions that things that can happen. You have a significant risk of all these things happening. And rather than me try and read that to you, because let's face it, we know I'm going to mess up on some of these things, I want you to hear this. I actually have this set up. It's going to read it back to you. I want you to hear what can happen from this. And we'll go back to Lancet so you can follow along at the same time. This is just startling. It is really bad. And someone's probably getting ready to put he's fear-mongering. No. 460,000 children? That's real. That's a huge study. Listen to this. I'm going to mute the mic so you can hear this.
Including myocarditis, changes in taste and smell, thrombophlebitis and thromboembolism, heart disease, acute kidney injury, fluid and electrolyte disturbance, generalized pain, arrhythmias, abnormal liver enzymes, chest pain, fatigue and malaise, headache, musculoskeletal pain, abdominal pain, mental ill health, POTS or dysautonomia, cognitive impairment, skin conditions, fever and chills, respiratory signs and symptoms, and cardiovascular signs and symptoms.
That is a lot of different things, all because you get reinfected a second time. Now, it is 2025. This pandemic started in 2020. We know darn well there are now people that are on their third infection, some even more, and we're talking about kids here. Multiple COVID infections, getting reinfected again and again is not good. Okay? Your kids have to go to school. Could you homeschool them? Yes, you could. But when your kids go to school, there are things that go wrong. This here is a CO2 meter. It's an ARANET 4. This can tell you what the CO2 level is in a classroom. I guarantee you in the classroom, or better yet, the cafeteria, or wherever, those levels go upward. We have seen cases where teachers take readings in their classrooms and it goes upward. Proper ventilation and masking does work, my friends. It does work. We need to protect our kids. I mean, did you just hear some of those things that were just read to you? I mean, heart disease, acute kidney injury, POTS. I mean, on and on I could go. This is not good whatsoever. This study did make it into the archive over at datareport.info. you may want to take a look at this, especially if you're a parent. This is really serious. It's not good whatsoever. All right. We're going from some bad news. I got to go to a little bit of good news now, and I do have a little bit of good news today. Utah pharmacists can give COVID-19 vaccinations without a prescription, which that is some good news, and it does not stop in Utah. We do have another state as well, this one being a surprise. I think you know why. No prescription needed for COVID-19 vaccine in South Carolina, experts confirm. I'll tell you why I said what I said, because it tends to be a red state, red meaning Republican, but hey, this is a good thing, and there was that bit of information that was passed. So, yes, it is slowly starting to get easier once again to get vaccinated in some of these states, but there's many others that are saying, oh, no, 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 you got to be 65 and older, you got to have prescription, all these different circumstances. All right, moving on to this. Kentucky, Louisville. Health officials warn of concerning rise in West Nile virus. Yeah, this is something we've been talking about in many different places, and it looks like 9 people have contracted the virus, and they were between the ages of 40 and 70 years old. Alrighty, Listeria outbreak linked to prepared pasta meals. You may have heard this on the news lately, but yeah, there is a Listeria outbreak ongoing, and it looks like this is affecting Trader Joe's, Albertsons, Trader Joe's Cajun-style blackened chicken breast, fettuccine Alfredo, that's one of the things, Albertsons pasta salad, and there are a whole bunch of other things listed here. I'm going to make sure this makes it onto the website. There will be a post later this evening with all the news stories used in today's virus update. All right, now moving on to this, we do have a tuberculosis case for you, confirmed in Rockingham County School. This is in Virginia. That's what I was looking for, to see which state it was. See, sometimes I put these things up the night before, and by the time we record, we forget which state it's in. Health officials are conducting contact tracing after confirming a positive tuberculosis case within Rockingham County Public Schools, of course. As you know, this has to deal with the school. Kids could be exposed. It goes into the school illness outbreak thread, but it does not stop there. Oh no. Unfortunately, we do have another school also dealing with a TB case. This time it is in the state of Michigan. Fenville High School is dealing with a case of tuberculosis at this time. And the individual is currently in isolation and receiving treatment. The health department, along with the Fenville Public Schools, is working to ensure the safety of all students and staff by implementing a comprehensive response plan. And of course, they say their top priority is the health and well-being of their staffs and students. Yeah, well, maybe it is, but viruses still do continue to go around, so maybe you want to rethink your plan. All right, moving on to this. In Wisconsin, endangered whooping crane dies from bird flu in Wisconsin. Yeah, we've been seeing more bird flu cases pop up lately, and this is a good time for us to go over and check that bird migration. Hey, when I was out this morning, I saw birds really high up in the sky flying in a V shape, and they were flying southward. They were flying in a flock, so yes, birds are migrating right now to the south for winter. Let's see how many birds migrated in the last 24 hours. Take a look at this. It is in the hundreds of millions once again. In fact, it did reach almost 500 million birds. And you can see the east and northeast was pretty much where the highest activity was. And when I say almost reached 500 million birds, that's at any given time. The total for the entire night is actually even higher than that. All right, moving on now to this. In the Twin Cities, yes, Twin Cities are dealing with a problem. 3 new measles cases have been detected by the Minnesota Department of Health. They're saying that they've confirmed the cases are each in unvaccinated children in Dakota County with no history of recent travel. So if there's no history of recent travel, that means it could be spreading within the children. The agency says health officials believe the children were exposed to measles from an unvaccinated family member who'd recently traveled domestically and reported measles-like symptoms but was not tested. So who knows, there could be more measles cases in this area. Yeah, that's not a good thing. Speaking of that, I decided now would be a good time that we go to Canada's website and see what the total number of measles cases is there. They say in week 38, September 14th through the 20th, 34 new cases were confirmed, 27 confirmed, 7 probable were reported in 2025. The total so far, this is 2025 total now, 5,006 measles cases. Yeah, Canada is not doing well. And if Canada has that many cases, you know darn well we're likely missing cases here in the United States. There's no way our reported number is actually correct. Last count that I saw was we are over, I believe I have the dashboard here. Here it is. Let's refresh this. Latest count as of September 30th. Yeah, we're up to 1,544 cases in the U.S. Will we hit 2,000? I don't know. But even if we don't, by confirmed cases, you just saw in the Twins area there was someone who didn't even get tested, who had measles-like symptoms. Yeah, our real number is actually higher, and the real number probably would be over 2,000 by the end of this year. All right, tomorrow is Thursday, which means we will get the update from the UK tomorrow. Nothing to talk about from there today. Taking a look at the viral activity levels for COVID and other viruses in Canada. No change. Moderate for COVID. Flu A, Flu B, and RSV low at this time. Let's take a look at what's going on with the air qualities now, shall we? And we do need to refresh this. While that's refreshing, let's pause and take a hydration break, shall we? Alrighty, doesn't that feel much better? Some slightly good news here. You can see the West Coast. Now, there are still some oranges, even some reds, but you can see less widespread in the Pacific Northwest. Washington, yeah, you still have some oranges, even a little bit of purple, but not as bad. Alberta, Canada, yeah, you're still dealing with some problems at this time. And the Plains, we do have a large swath of yellows, which that's poor breathing quality. Same with the Carolinas as well, Virginia, Kentucky, Illinois, Iowa, Minnesota, almost into the Great Lakes. The Northeast is doing great. In fact, the sky is so clear here that we had some really bad sun glare this morning when the sun was coming up. Taking a look at what is going on in Pinellas County, Florida, and we do see just a lot of calls, just a general mixture of things, so that's not good. Philadelphia, taking a look at their call volume for Tuesday, if we can, and we can see here on Tuesday, Philadelphia had 782 EMS calls. Doing a live look at what is going on in Montgomery County, Pennsylvania, finds that there are 14 active calls right now. Taking a look now at what's going on in Chester County, Pennsylvania, and you'll see here there are several calls going on there. We do see sick person, respiratory difficulty. Oh my, I'm seeing cardiac arrest show up not once, but twice. East Coventry Township and East Vincent Township, Chester County being just west of Philadelphia. Not good to see more than one cardiac arrest call at a time. That is never a good thing whatsoever. Taking a look at what's going on with the hospital situation in Pennsylvania, and some good news here today. Things are slightly better now in the Lehigh Valley than they have been the past couple of days. You can see here Allentown, Easton, Bethlehem area of Pennsylvania, and we can see South Central Pennsylvania. Let's see, yeah, Wellspan, Gettysburg. This is still not updated. I don't know why that is stuck on that. And we do see some problems here in South. Yeah, again, some of these hospitals have not updated. Bryn Mawr Hospital did, and that's reporting emergency department overcrowding at this time. That's not a good thing. Taking a look at New Jersey, and I think we have a couple problems here. Riverview Medical Center, psychiatric issue. Inspira Medical Center, Mullica Hill, full and total divert. And we also have St. Luke's Hospital, Warren Campus, adult emergency department issue. And let's see. Yep, that's it at this time. So, yeah, a few problems in New Jersey today. New York State, I need to refresh cases. We do have a hospitalization update. I don't know if this is a new case number. I think that's the same one from yesterday. But 447 cases on the most recent update. Hospitalizations, significant decrease. 469 and 52 in the ICU, much lower than yesterday's 514. I can now say with confidence, I'm pretty sure New York State has peaked for hospitalizations. What do we watch next? Well, we watch the drop. We want to see how low they go before the next wave starts up. Hopefully, it would be really nice if they could go back into the 200s once again. I'm hopeful they can. We'll see. As you know, sometimes after Halloween, there's a lot of parties with Halloween. We see a little bump in the road, and then it levels off and doesn't really drop, and then another bump with Thanksgiving, and then you know how that works. So we'll have to wait and see what happens. Alrighty, let's take a look at some wastewater sites, shall we? So more good news here. I'm trying to be positive because that opening story with kids being able to get reinfected issues much easier after a second case. You get the second case, and then, oh, your risk of new issues is much, much higher. That is just, wow. It shouldn't have to be this way. I mean, we could have prevented this from happening, but no one wanted to. All right, take a look at wastewater here. Medium across most of the U.S., with exceptions to the Northeast. Let's take a look at the Northeast. We see Stamford, Connecticut. What's going on there? Stamford, Connecticut, yeah, medium. Not really dropping or rising at this time. Kind of leveled off. We do still see some high wastewater sites in portions of New Jersey. I think eventually that's going to start coming down because going down Jersey Shore, the time of year that people do that, I think that's really starting to slow off now. In Maine, this is one of the reasons why the Northeast is still high. Lewiston, Maine. Yeah, very high wastewater here. Not unusual for this wastewater site. If you click on this and go back and take a look at previous history, let's do that. You can see, yeah, take a look at that. This wastewater site has gone high before, so it's not the first time it's happened. It's just perhaps one of the reasons why we are seeing the Northeast continue to be up. We also have Oswego, New York. Take a look at this. That has dropped at this time. Still listed high, though. All right, let's go elsewhere in the United States, and let's go down to Dallas. Look at this. The wastewater sites in Dallas, Texas, are starting to show up as lower. You can see Dallas, Central Dallas. Hey, this is some fantastic news. So things are improving there. How about Florida? Are we improving there? Yes, we actually see low now in Jupiter, Florida. That is a huge, huge improvement from where they were a little bit ago. Let's take a look at Orange County. Look at this. We can see Orange County, Florida, Orlando area. We actually see some mediums showing up. We still do see a couple high spots. Let's see what that's all about. We can see the eastern Orange County is still high. How about Southwest? Yeah, that is coming down as well. So this is some fantastic news to see. Let's go out to the West Coast. Let's take a look at Las Vegas and Las Vegas, Nevada at this time. Hey, take a look at this. Las Vegas, Nevada, medium. Not really dropping, not really rising. Pretty much holding steady at this point. Let's take a look at San Francisco. Can we keep the good news going? Let's see. Can we? And we can see, yeah, San Francisco dropping. But I do have to draw your attention to this. Though listed at low, RSV at this time, though listed at low, you can see, take a look there. Yeah, it is starting to go upward. We probably will be going forward. We're not just going to only look at COVID when we look at these wastewater sites. I know we just did that for the other ones, but that caught my eye there. I actually did not see that beforehand. We're probably also going to start paying more attention to some of these other viruses instead of just skipping over them, because it's getting to be that time of year where COVID's not going to be the only concern. Of course, we've had hepatitis here. We've had the Mpox in a few cases. Wow, they've had a lot of Mpox detections over the past few months. Measles, we've talked about a lot, but it's getting to be that time of year. HMPV, Influenza A, Influenza B, RSV, and yes, more norovirus is going to be coming soon. All right, let's go over to the Midwest. The Midwest will be where I leave you off for today. As you can see here, we still do have a high detection in Wisconsin. Only one wastewater site in Wisconsin. Why can't we get wastewater for Green Bay, Milwaukee, Madison, some of these other places? It just absolutely makes no sense to me whatsoever. Let's see what's going on in Akron, Ohio. Of course, Ohio's dashboard for COVID does update tomorrow, their respiratory dashboard, and we can see COVID here is still listed at high. Do you have a norovirus issue? No, you do not. Everything else is fine at this time. All right, just one last time. I want to go back to this. Risk of long COVID in children may be twice as high after a second infection. The new studies show involving, again, 460,000 U.S. children found those reinfected with COVID-19 during Omicron. Again, we're going back to the Omicron era, but they had twice the risk of developing long COVID. This is the time frame where you were told, oh, things are fine, we got to get back to normal, rush back to normal, and meanwhile, oh, so many people were getting infected at once, and, well, as you can see here, twice the risk of developing long COVID. And let me tell you something, this is in children now. Let me tell you something, you were also told kids cannot get COVID bad. That was a total lie. It was a lie. Look at this. The data clearly shows kids can get it bad. And I got to tell you something else. There is potential at some point we could see another Omicron-like event. I don't know when that's going to be. There's this BA, what is it, BA 2.3, I think it's called. We just mentioned it the other day. Who knows what that could do if it takes off and goes around the globe and becomes the next big wave. Alrighty, folks. I mean, this is serious here. If you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Wednesday afternoon. And thanks for watching.